region of印度. Some of the numbers, as of today, the total number of confirmed patients have rose to 19984, among which, and they also report 640 deaths. So compared to 1 hour ago, it has increased by about 900 cases. Second, let's take a look at the policies. The government has already allowed some of the industry to resume their work and production. And three, some of the challenges faced by India, big population and poor infrastructure and health system and weak health system. So how should Chinese in India take care of themselves so as to and protect themselves during this special time? We will be inviting our experts and our ambassador and viewers to discuss some of the issues we've mentioned. And you are also welcome to raise your questions through our portals. Hello, Ambassador Zhang. My greetings goes to all the Chinese living in India and all the viewers. Dr. Zhang, hello again. It's my great honor to be here again. So I would know more about the situation in India. And hello to all the rest of our guests. So Ambassador Sun, it's a great opportunity for us to gather online. So can you give us some remarks first? First, my gratitude goes to CCTV for providing us with this platform to communicate to our audience, as well as our Chinese compatriots in India. I also want to thank the Department of Foreign Affairs, the Ministry of Foreign Affairs, for your support. Since the outbreak, General Secretary Xi Jinping made important instructions. He stressed that we must attach importance to the health and safety of overseas Chinese, and our embassy has taken a series of measures to protect our national compatriots in India. And this is our first priority amongst all. I remember on March the 20th, I once discussed with our overseas Chinese, some overseas students and entrepreneurs in India, and I've taken some of your questions. Right now, a month has passed, and we've seen some new developments as to the outbreak. So today, I'm once again very honored to join all of you in discussing this matter again. It is fair to say that the epidemic is still developing in India. As the moderator mentioned, the total number of confirmed patients is about to exceed 20,000. So I think this discussion is held at the right time to hopefully can take some of your questions and improve your awareness and confidence of fighting this disease. And we are very honored to have Dr. Zhang Wenhong with us. Dr. Zhang has become a popular medical expert. He's also then a director of Huashan Hospital in Shanghai. In multiple video conferences, he has made important remarks and have given helpful advice. Many of them have been passed on from person to person. I once talked to him a few days ago, and I told him that our Chinese compatriots are very honored, and I look forward to talking to him. So he agreed to join us today. It's also something that we very much look forward to. And the pleasure is also mine to talk to our Chinese compatriots in India. So that would be my opening remark for today. Dr. Zhang, we will be first listening to some of the remarks and questions from our other guests. And the first question will go to the ambassador. Okay. Mr. Yang, please. Ambassador, moderator. I'm an overseas student here. We have already received a medical kit distributed by the embassy, and it's really heartwarming to receive such much needed assistance from the embassy. So if we are running out of medical supply again, can we ask for more from the embassy? Thank you for supporting our work, first of all. It is important for us to safeguard the health and safety of all the nationals, Chinese nationals in India. It is our first priority. Currently, according to our estimation, the total number of Chinese nationals in India is 3,100. And so far, we have no report of the infected cases among the Chinese nationals. About 240 Chinese students are pursuing their study in India. The number is not that big. However, you are still faced with complicated situations. For one, most of you are living far away from each other because you pursue studies in about 27 schools in 10 different states. So it's not easy for you to communicate with each other. And also, some of you are living in poor accommodations due to the infrastructure and transportation facility in India. Many of the students are living in remote areas. After the national lockdown, as far as we know, in diet and other aspects of life, you ran into some difficulties. So it's important for us to take care as much as we can your accommodation and daily necessities. After the lockdown, the logistics in this country has also been suspended. The Chinese embassy has mobilized resources through the Chinese nationals as well as Chinese enterprises operating in India to distribute the medical kits to the hand of the overseas students to show that the government, the Chinese government, cares about you. As far as I know, in your university, altogether there are 102 Chinese students, which is a large group comparatively speaking. But no Chinese enterprises are operating nearby. That's why we have contacted the nearby enterprises in neighboring cities to help you to address your problems. It is worth mentioning that Madame Chen Bing from the Chinese Association in India, who has done a lot and has been a great help to us when we are gathering and distributing the resources to our students. She personally drove 6 hours to send the packets to you. There is also an academy called the Enterprise Development Academy. There are also Chinese students there who cannot stay at home, stay at school due to the lockdown. And the local Chinese enterprises also help them with their accommodation after the lockdown. So hereby, I'd like to extend our sincere gratitude to all of the Chinese nationals and enterprises in India. The embassy has established 3 chat groups with the overseas students. One is for the students, one is for their parents, and the third is for all the important people of contact. We also have established a WeChat group of local entrepreneurs so as to facilitate communication between different parties. Not long ago, one of the parents have wrote to me thanking us for our support to the Chinese nationals in India, and which is also a great encouragement to me personally and to the embassy as a whole. So I wrote back to this parent saying that we hope that our nationals can obey the local rules and policies, protect yourselves, strengthen your physique, arrange your daily job and work well so as to pass through this safely. And after this has passed, you will become the mainstream to help us to realize national rejuvenation. So if you're running out of medical supplies, no problem, contact us. Do not hesitate to seek help through your WeChat groups and our official website. The embassy has procured another batch of medical supplies, and hopefully we can finish the clearance process as soon as we can. These are much needed drugs and PPE equipment. Should you run into other difficulties, you're all welcomed to contact us. So our chat group will be a bridge that connects us all, and we're always ready to help you out. We have a lot of fans of Dr. Zhang leaving multiple messages. So I have chosen a question, a comment. Some people are worried about the capacity in hospitals as well as the testing capacity in India. Is it possible for a patient to receive the medical need that is necessary if they get infected? The embassy have been keeping in touch with the local medical authorities. We also have required that they strengthen the health protection and treatment of local residents. We also have been keeping in contact with some of the private hospitals. We have sent 15 notices and 30 more messages in our chat group. If, unfortunately, you are diagnosed with COVID-19, please don't hesitate to call the hotline of the embassy, and we'll help you to urge the medical institution to provide you with the treatment that you need. So you ask if there is a medical team from China to India. So far, we do not have the plan. Actually, the medical capacity in India is quite good, especially when it comes to its pharmaceutical industry. So the government has also been taking multiple measures to strengthen their infrastructure and capacity building. As far as we know, there are more than 2,100 medical institutions that provides 22,000 ICU beds and more than 170,000 quarantined locations, and they're even planning to renovate trains into quarantined wards. So if you ever got diagnosed, please seek medical help in your nearest hospital, designated hospitals for help. One more question to the ambassador. Mr. Wang, do you have a question? I think there is a loss of signal. So our next questions will go to Dr. Zhang, and Dr. Sun can take a break right now, and we will be inviting you back towards the end of the discussion. Our ambassador has mentioned some of the basic situation. So I want to report to you on the numbers first. Total number of confirmed patients, 19984, with 640 deaths. Dr. Zhang is very familiarized with the Chinese situation, but I'm not sure if he is very familiarized with the situation in India. And we have a lot of viewers online sending their greetings to Dr. Zhang. And later, Dr. Zhang will also be taking your questions. So are we ready to have Dr. Zhang to the podium? One of the numbers caught my eyes. Nationwide, there are 78 reporters that have been reported infected. And people are also concerned about the situation of the slums. So, Dr. Zhang, can you hear me? So, without further ado, any questions for Dr. Zhang?
喂，好，能听到，请说。主持人好，当前的
We are very concerned about the development of the epidemic in India. As of yesterday, the number is approaching 20,000. The testing capacity and proportion in India is relatively low, and there are many asymptomatic patients as well. We believe that the actual infected number is larger than the official number. Back in 1918, the situation was quite similar. So, Dr. Zhang, do you have a basic prediction as to the development of this epidemic in India? We are seeing an increase in terms of the number of confirmed patients. Right now, the total number of confirmed patients in India is about 820,000. But India has a larger population than the United States, so the infection rate is actually lower in India. There are also asymptomatic patients in India. This is also discovered due to the screening process in the population. So it's obvious that the actual number of patients is larger than the current reported number of cases. So is the current number the real situation or just a consolation to the public? You might never know the actual number. There are 800,000 infected patients in the US, and now several states are ready to resume their work. And so is some of the countries in Europe. That is because when the number of patients received a certain peak, they would believe that it's okay for people to go back to work.
我打断一下，现在声音有点卡，可能我们的网友听着有点费劲哈。我们这样，我想请大使先出来一下，顶你个班儿，然后让我们的导播把您那边的。
Well, we are experiencing very bad signal right now. Probably our viewers cannot hear you very clearly.
对对。这样，张教授，现在好像又好一点，您能再说两句吗？我们在线。
I think the signal is getting better. I will just finish what I have said. My key message is that we shouldn't be too nervous about it. In the United States, there are more than 800,000 confirmed patients. And after very hard work, the number will be reaching a peak. And you can tell it from the daily new cases. That is the most important indicator. You shouldn't look at the total number, but the new numbers on a daily basis. Take Europe, for example. Their number of new cases are also increasing on a daily basis, but they didn't stop our work and study. And slowly we can see that the number is stabilizing. I think it will be the same case in India. And you have a lot of experiences. I think it's quite impressive that none of our Chinese nationals have been infected. It is not because we are very immune to this, but because you have very good personal habits and you have learned from some of the experiences from other countries. I think the signal is not very stable. Can we test? Can we have a test? A sound check? Okay, Ms. Yan, please.
主持人好，张教授好。我是尼赫鲁大学的留学生，我叫燕安婉。我主要是想问一下张教授。
An overseas student in one of the universities here. There is a general understanding that the Indian people are more immune to diseases than the average people. Are there a lot of asymptomatic patients in the public? Are we putting ourselves in danger if that's the case? And how do we protect ourselves better? First of all, as to the immunity, there is no evidence showing that the Indian people are more immune to COVID-19. If you're in major cities, you may find that there are more young people. Most of the senior citizens are living in suburbs or villages. I believe that the infection rate in communities in India is quite high, but not all of them can get tested. So it's unrealistic to believe that the infection rate in community is low. There are a lot of patients who fail to get their sample tested. Most of the young people who get infected are general cases or mild cases. I once read a news that there are religious gathering in India, and none of the people are wearing masks. This is not because they are physically more immune to this COVID-19, but they are mentally immune to this disease. They have their peaceful mind. According to our study, it is fair to say that all people are susceptible to this disease, to this virus. In the United States, there are 800,000 cases. However, they have not received herd immunity because the infection rate has not reached 10%. That means that the majority of the population do not have immunity to this disease. As for this virus, I believe that if you want to reach herd immunity, you are still far away from that goal. Currently, the only thing that you can do is to protect yourselves, and that's what China has done. In India, I heard that there are industries and enterprises that have resumed their work. So it will become a new normal probably in your society and in US and Europe and in China. There are some important experiences that you need to borrow from. This is how we are going to live in the foreseeable future. That's how China has done, that's how America and Europe is doing, that's how you will do in the future. I think the infection rate in India will not exceed 10%. So 90% of people around you are clean of the virus. So let's do another round of sound check. Okay, next question, please.
刚刚问第一个问题。
好，您再说第二个。
喂，
您说第二个，对。
想问张教授第二个问题，就是莫迪政府啊，3月24号就宣布了封城。其实在这更早之前呢，
the government
印
has
度已经封国了。原定于
issued
4月
a
14号
national
它就是封城
lockdown.
结束，但现在又延期到5月3号。
Originally, the lockdown would last to April the 14th, and right now it has been extended to May, but we are seeing an increasing number of people on the streets as well as people at work. So how do we protect ourselves? What kind of measures should we be taking right now?
复工复产下的防疫措施。一些做法，紧着，好像
采取这种到特别看的这样看医生市场因为要就主要可以，所以是一致的。但是现在问题在哪里呢？就是说，比如说中国把
I think the biggest
政策做到
problem
100%，那么各个国家
is to the 100% implementation of the policies, but each country will decide as to the implementation, the degree of implementation of the policies. So India is relatively a late starter in terms of the preventive measures. If we take a look at the US, you can take a look at their policies and the effect of their policies and how did they end up. And currently, Europe and the US are taking different paths, but their results seem to be very similar. And right now, both of these regions are reaching a plateau stage in terms of newly increased daily cases. Most of the death cases are senior citizens and people with pre-existing medical conditions. The young people are relatively less affected, and they are experiencing lighter syndromes. After the lockdown, although they are not well controlled as China, gradually the number of new cases will be decreasing as time goes by. As long as you can see that, the government would think that their curbing measures are effective because you're seeing this plateau. And besides, the public will be developing their awareness to protect themselves during this process. And there are also people that are and workers that has to go back to work to sustain the operation of the society. There are a lot of people in the US that do not have a lot of deposit, and they began to receive financial aids from the government. There are also people who has to pay back loans. If you do not have income for a too long time, you cannot pay back your loans. So when the new cases are decreasing, people will be resuming their work and life, and it's government's responsibility to lose their control step by step. I think currently this disease is still controllable as the number of new cases goes down and the fatality rate and infections rate goes down. I think that's the case in India. Even during the Spanish flu, it shows similar symptoms and trends. For senior citizens, my advice is to avoid unnecessary travels outside. But the absolute number of infected patients is expected to increase, but the number of new deaths, will be decreasing. So there is a trade-off relations between the control measures and the resumption of work. In India, there are a lot of asymptomatic infected patients, and it's fair to say that there are a lot of people that did not get diagnosed after all. So it's unrealistic for India to take the Chinese path right now. It's too late. I talked to some of the colleagues from home and abroad yesterday. They asked that why there are only 400 cases in a city of more than 30 million people. At an early stage of the outbreak, you can control this spread of the disease by very strict control measures. But currently, it's unrealistic for India to do the same. You can take the European path. My French colleague yesterday have shown some positive expressions because right now they are seeing greater hope in terms of curbing this infectious diseases. I understand all of the measures taken by the Indian government. The lockdown and the testing have already been implemented. Each country is taking their different measures. We shouldn't be challenging your local government for their control measures. Maybe you're lacking in terms of testing, but your policy is not that much different from that of US and EU. For anyone who has been admitted in a hospital, you have to get tested. But right now, it's not necessary to test all the symptomatic or asymptomatic population. So I don't think you should be too concerned with the situation, because it's right now already unrealistic to do a thorough screening of all the population. I think the key is not to urge the Ministry of Health to test more patients, but more realistic to protect yourself better.
请问张教授最后一个问题，也是我们最关心的一个问题，就是张教授，您认为
Another question,
的拐点何时会出现
Dr. Zhang, when will the turning point be reached in India? I think right now it's too soon to tell, but my personal prediction that it will be similar to that of US. The number of new patients will be reaching a plateau. Towards the end of April, many states will be reopened. India has implemented a lockdown, but I suspect that the force of such lockdown will be as effective as China. If it's poorly implemented, even after you go back to work, there might be a second peak in terms of infection. So it's more realistic for the government to treat it as a normal condition. I don't think it's necessary for the government to wait until that all the new cases have zeroed down before they ask people to go back to work or go back to school. The U.S. path is made due to their national conditions. I'm not blaming them or anything. But I'm just saying that once you go back to work, the number of new cases is expected to rise up again and probably will reach a second peak. That is to be expected. That did not happen in China or in Europe, but the U.S. Lockdown is relatively late. Currently, they are showing a plateau, but different states have different control measures as to the implementation of lockdown, and they will decide on their own how long the lockdown will be and when will they be back to work. So I believe that the Indian government must seek a balance. So my personal belief is that the development trend in India will be more similar to that of U.S. If the number goes up again, it is because probably because of your testing capacity. Because this epidemic is different than SARS in 2003. Because during SARS, if you caught SARS, in about 2 to 3 days, your symptom will be worsened drastically, and a patient is likely to die in about 2 weeks. It has very high death rate. However, COVID-19 is a more mild virus compared to SARS. That's why we're seeing the countries in Europe are ready to go back to ask their citizens to go back to work and study. So I think it's not necessary for you to be over panic. If India or Latin America or other Southern Asia countries have shown epidemic, this will be getting out of control. But currently the whole world basically is getting out of control, including the US and Europe. The spread of this virus does not mean that everything is getting out of control. And it's unrealistic to expect all of the governments to take the same measures as the Chinese government did. The only thing that our Chinese nationals can do is to protect yourself and maintain a calm mindset. We are also facing risks as to imported cases in China. Our situation has been brought into control, but right now we are facing mounting pressure from the outside. This is truly a community of shared destiny, and no country is immune to this. For all the Chinese nationals, it is not necessary to persuade all the people around you to follow our suit. Just find the right path based on local conditions. That's just some of my personal opinions. Thank you, Mr. Zhang and Mr. Li.
主持人好，张教授您好，我是常年定居在
Hello, I'm Chen Bing from Bangalore. My question is, there are traditional Indian medicine treatment of COVID-19. Do you have any knowledge of that? Why don't you tell me more about this Indian measure? It's a bit similar to TCM. They use herbs. This is a herbal treatment. It is called Ayurvedic medicine. So it's Indian traditional medicine. I'm not quite familiarized with the Indian measures. There are a lot of traditional medicine across the world, the TCM and the Tibetan medicine as well. These are the crystal of human civilization. It's not necessary for us to exclude one medicine or another. I suggest that you use these measures as auxiliary methods. If they're proven to be effective, it doesn't hurt to try. But more importantly, I think self-protection is more important. Yesterday, my French colleague asked about my personal experience in terms of medicine. My answer is that no drug of any country, of any tradition, is proven to be the specific drug to treat the disease. So my reminder for you is that you can take some of the traditional medicine to use them as preventive measures. I believe that the embassy has already provided you with some of the medical supplies, but apart from taking those preventive measures, I believe that physical quarantine, mask, social distancing are also necessary. You're not immune to this disease, even if you have taken all of those medicine. No one in this world is immune to this disease, so to speak. Self-protection is more important than anything.
好，我们现在看看此刻还有谁的信号在线哈？哎，我们看张先生好像在动，张先生能听到我说话吗
Mr. Zhang, can you hear me?
张先生又卡住了。那张先生可以来，张先生有没有问题问张教授？
好的，张教授您好，张成立是东方电气印度有限公司。
Zhang Chengli, and I'm one of the entrepreneurs in Calcutta. The lockdown is supposed to last till May the 3rd. Some of our employees will have to go back to the country to resume their visa. How to protect ourselves during this travel?
各位嘉宾说完话都关上麦克风。张教授来，能听到问题？
好的，好的，因为整体上来讲，我认为呢，国际的航空的打开，可能在未来的几个月里面。
We're expecting the resumption of international travels in the next few months. But currently, it's quite difficult for even Chinese nationals to return to China, but not impossible. During this process, there still is a risk of getting infected. This is for sure. The biggest risk lies in the fact that your hands is likely to touch the surface, any surface that might be contaminated by the virus. Your passport that you have to hand over to the immigration, for example. So the immigration officer have their hands contaminated during their work, and in turn, your passport is likely to get contaminated. So each of this is a risk factor. For example, you can cover your passport with some kind of plastic cover. So after all of these quarantine process, immigration process, the first and foremost thing that you should do is to wash your hands. Second, place all of your food in one special bag and do not mix these food with other things. And always wash your hands before eating. The third risk factor is the person next to you. Make sure that you wear your masks all the time. If you both wear masks and you don't touch this person, you do not have any physical contact with this person, there is very little risk for you to get infected. And you have to watch if the person next to you is wearing a proper mask, that is a mask without any valves. Because if he is infected and he wears a mask with a valve, it is still likely for him to spread the virus through breathing. And I don't suggest that you have any conflict with this person who is wearing a mask with valve, but I would suggest that you wear the mask all the time. There is no evidence showing that there is transmission through air in the cabin. However, we don't suggest that you take off your mask. But sometimes you have to take off your mask to eat. I think it would take about 8 hours to fly back. You can take a nap and take some sleeping pills if necessary. But make sure you take some food and drink some water. I don't suggest instant noodles. does not have enough nutrition. I suggest that you take some food with enough high quality protein. You can order food from the restaurant, from the caterers, or you can bring some on your own. And after getting off the plane, wash your hand again. And again after you have gone through customs. If you have done all that, you will have very little risk of getting infected.
我们新上来，张教授有要补充的吗？到时候又没有补充。好，各位新上来的嘉宾，还有没有能？好像的确我们还挺卡哈。还有一位燕同学来，再问一个问题。
对，我还想再问张教授另外一个问题，就是因为作为我们留学生，我们一般住宿呢，如果是在外面是合租。
For overseas students, sometimes we spend we share a room with other students. Currently, we are studying at home, but we share rooms with other people or share apartments with other people. So how do we protect ourselves at such a condition? Is your roommate Chinese, or are there other people, other nationals? If we rent apartment outside, mostly it is with our Chinese nationals, compatriots. But if you're staying in dormitory, you will be sharing a room with Indian students. I believe that the infections rate in India is relatively high. If you're living in a dorm, I think the risk of infection is high because you share a room, very narrow space. There are only 2 or 3 people that you spend most of your time with, and it's unrealistic to wear masks all the time indoors. So I don't have a suggestion for you in this kind of situation. I think it's you two are on the same boat, to be honest. Almost like a couple. The only suggestion I can give to you is to strengthen your physique, have enough nutrition intake. For young people with normal physique, you can pull through this with your own immunity. Right now, we are seeing more and more people going back to work because the economy simply cannot endure this kind of lockdown for too long. Many people will lose their source of income. Many enterprises will go bankrupt if we do not restore our work. For China, most of the pressure lies in the community workers, the hospitals, and the doctors. However, in India, it's each person's responsibility to strengthen your physique. Some of my remarks actually triggers controversies online as to what kind of food is nutritious, and you can look up online yourself. But my concern is that you should take healthy diet. If you are living outside with Chinese people, you should form a pack. But I heard that the 3,000 Chinese nationals are all healthy right now, which I think is a very good signal. So my suggestion is that wear a mask all the time, despite what other people think. I believe the embassy will have enough masks to distribute. If you are running out of masks, contact me. I can find ways to transport some of the masks to you.
孙大群在屏幕之外啊，挺神奇啊，口罩供应公司。好，
是的
小。燕，您把你的麦克风关掉，有干扰哈。小燕一定要记住，不说话时候关麦。好。
然后呢？
还有补充吗？
就是说戴口罩，然后呢给人家的社交距离可以保留呢，尽量保留。但是按照现在的经验
，social distancing, wear masks, wash your hand, so as to avoid the risk of getting infected through droplets. It will be enough for now. So social distancing is first priority. If that's not possible, wear masks once you're in contact with other person. Otherwise, you put yourself into risk. But you have to take off your masks when you're eating. So timing is very important. We don't suggest that two people would sit together, take off their mask, and have dinner. That will constitute a risk factor.
就是戴口罩跟人家，我放弃就是跟人家共同一起吃饭的权利。你如果做不到这一点，那就准备好。
If you can't do that,
多吃蛋白质，还要锻炼身体。就我拼着让自己免疫一下。
make sure that you eat more high quality protein to improve your immunity.
所以我觉得策略。现在事实上是越来越简单了，要做是。
So it's actually quite easy for you.
最后的也没有想的多，就是因为大家很好，在医务感染基本上就没有，医务人有不要，所以我这里呢建议大家能够切实的一周后的采取防疫的一个措施，好吗？
好，谢谢张教授。再提醒哈，我们所有嘉宾把麦克风关一下，防止互相干扰。似乎还有没有关的哈？张教授，我这边有一些网友的问题，我也来提给您哈。大家很关注最近关于潜伏期超过14天的一些。
People are concerned with some of the patients with
境外返回人员的隔离期进行了调整。有的要求14+7或者14+14的
incubation time that is longer than 14 days, and that would lead to some policy changes in some localities. Is that really necessary?
是这样的，现在呢，关于一个无症状携带者，是不是继续
Currently, when it comes to asymptomatic patients, there's still hard to tell whether this asymptomatic patients will continue to spread the virus. But for a patient who have a longer incubation time than 14 days, there are very single cases. This person, during their quarantine time, is very likely to have already received a nucleic acid test, which will substantially reduce their risk of spreading the disease further. So after 2 weeks quarantine, it is not likely for someone to go to the public without being tested and still has ability to infect. Think the virus is most infectious in the first week after the symptoms are showing. There are countries who set the time for quarantine of 1 week. So I think 2 weeks is quite enough. Therefore, I do not think it's necessary to extend the mandatory quarantine time to 3 to 4 weeks before more evidences, concrete evidences are showing. We have one single case in Harbin that potentially has a incubation period longer than 2 weeks, but we could not tell if this person gets infected after his quarantine period is over. Even if this is a patient with incubation time longer than 2 weeks, it is not reason for us to panic. We do not have any asymptomatic patient that still has the ability to infect other people after 2 weeks of quarantine. So what reasons do we have to keep people in quarantine longer than 2 weeks or even a month? So we have to follow General Secretary Xi Jinping's instruction to normalize these preventive measures. However, these measures has to be scientific and appropriate. It's not necessary to change the policy at the current stage or until more evidences are shown. This has nothing to do with our Chinese nationals in India. This is actually discussion of internal affairs.
张教授，还有一个关于国际整体疫情判断的问题，你之前也提了一些。我看到最新有一个提法，美国 CDC 的主任罗伯特雷
According to the U.S. CDC, there might be a second COVID-19 transmission that coincide with the flu season. So is that something that we should guard against? So FAS is not the first one to propose that possibility or make that judgment. I personally have also made similar prediction, and we kind of reached a consensus here. Based on the current preventive measures, we are taking similar measures that is similar to the flu season. So when summer comes, the infection rate is likely to go down. But the measures taken by other countries are not the Chinese path. Our path is to zero down the new cases. But if you take a look at the US, the India, or Europe, the number of cases will be fluctuating at a relatively low level. During SARS, the total number of cases is 10,000. However, right now we are dealing with more than 2 million infected cases. Right now it's too soon to tell the turning points in most countries, let alone when the pandemic will be completely over. But it is fair to say that for most infectious diseases, they will come back in winter, such as the famous Spanish influenza, whose second wave is actually more severe than the first wave. So we must be prepared. Last question for Dr. Zhang. You mentioned the word protein multiple times, and we have also read some of the controversies that your remarks have triggered online. You have done a lot of education, and will that affect you personally? Thank you for the opportunity to explain myself. And it's also an opportunity for me to publicize more knowledge as to diet. At the current stage, we need scientific suggestions as to the improvement of immunity. First, nutrition is important to disease prevention. Because in Shanghai, we have a large number of imported cases. We discover that for young people with good physique, it is not likely for them to develop into severe cases. But there are workers who would eat instant noodles all the time. So this person is experiencing malnutrition temporarily. But after this person came back to the country, we would suggest that this person intake enough nutrition, eggs and other protein on a daily basis, and we discover that antibodies will increase during this process. That's why nutrition is so important. If you are healthy enough, you can endure this process. You can pull through. I also talked with ambassadors in other countries. Some of them are asking that my children will go back to school. What should I do? Will my kid be infected? I said, of course. Can you stay at home? He said, no. If I do not ask my kids to go to school, I will get a fine. So either you go to school or you go home. You go back to China. So basically, there is no choice for them. But under such condition, it would be important. It would be important for you to protect yourself. My suggestion is that you wear masks. But sometimes it's forbidden to wear masks in class. So that would be the bottom line here. If you get infected, what should you do? My suggestion is that to feed your kid well, with enough protein, with enough nutrition. We have starch, we have sugar and fat and protein, among which protein can contribute the most to the improvement of your immunity. So my suggestion to all the parents, make sure that your kids have enough milk and eggs. The same suggestion goes to all the Chinese parents as well. The milks and eggs are locally produced,
对于抗疫当中的一个重要性。
and they are a
所以
main
今天
source
这个问
of
题，我也同样地
immunity
抛给了印度的
and
各位
building
侨
up
胞。
your physique.
在我们在那里生活的同时，在这个特殊的疫情时代，我们要比较平衡
And
的
this,
摄入各种
the
营
same
养。
suggestion
那么
goes to
在
all
这
the
个时候
Chinese nationals
蛋
in
白
other
质
countries.
是尤其的重要，好吧？仅供大家参考。
Protein is of paramount importance when you want to eat
看待一些观点的
healthier.
时候，我们理性一点哈，理性的去讨论，科学的去讨
We
论。
also call for more reasonable and scientific discussion on this matter.
传播的很多呢
Despite some of the poor connections, we have indeed learned a lot
在线
through our discussion, and we'll now
是孙大
have
使，那么最后还有
our
没有问题
ambassador back for some final remarks or questions.
哎，你好，主持人。
看看还有一点时间哈，还有没有哪一位我们的侨胞或者留学生有问题提给大使，可以举个手。
So, any question to the ambassador?
下我们的信号哈，可以，哪位在说话？好，我们刚刚看到应该是有一位在印度的侨胞朋友提了一个问题哈，关于对中国文化的问题。
One of the Chinese nationals have asked a question about the stigma of the Chinese people in India. But I think our ambassador has some problem with the signals. So we'll sum up some of the discussion that we have reached. So it's not a question about whether we should drink porridge or not. But I think the controversy is a good thing. The key here is not to drink porridge or not, but to extend this kind of discussion. Dr. Zhang has given us a detailed explanation of his remarks based on a lot of concrete research that is done in the city of Shanghai. Proteins are important and key to improve the immunity. So our ambassador is back online.
再稍等一下哈，今天我们的信号的确是有一些问题。
Apparently, we're running into multiple technical difficulties today.
我只能请张教授给我救急哈。张教授，因为现在屏幕上只有我一个人哈，我又不想自己说太多，所以只能请屏幕外的您给我救急哈。我们来把。张教授很辛苦，今天还有很多网友说，我们张教授虽然今天声音不太好，但是好像这个画面很好，就像开了美颜一样。对，其实从疫情。
Our viewers are saying that Dr. Zhang looks really good today.
所以现在
Dr. Zhang has actually done multiple video conferences with us.
只有咱们俩了，所以要不然我们再聊两句，也等一下大使。之前跟张教授说，今天我们连线是1个半小时，我们现在稍微有点超时，一会儿大使我们
We're running a bit over time.
就结束，不干预，不打扰您太多的时间。我们刚刚也提到了这个国际疫情的情况，您也说
So I'll make it short.
常态化的防控，您觉得我们现在常态化防控
You mentioned this normalized prevention and control, but we're still looking for an end to all of this. So do you have a prediction as to that?
中国提出来是很早的，其实习总书记在
Actually, General Secretary Xi has pointed out this a few weeks ago, saying that we should normalize our prevention. That is, we have to walk with both legs: prevention, control, as well as economic development.
但无论你是带病常态化还是病治好了常态化，道理都是一样的，就是把疫情处于一种可控的状态，同时发展经济。
One thing we have to realize is that we have to treat it as a controllable matter. But inevitably, we'll see more death. In China, in India, these control measures will be normalized. So hopefully in a few months, 2, 3, 4 months, we would open up airlines again, and our global village will go back to normal life, that is to say. But according to Dr. Fauci in the United States, it is impossible for us to go back to life as it is exactly, as it was exactly. So the best we can look forward to is that people can go back to life as much as possible. But you have to wear masks. And avoid large gatherings or unnecessary travels. So this is not life as it was. You have to make adjustment. So it is indeed a community of shared destiny. If the pandemic of the world is not over, it is difficult for China to stand alone. And China will also be adjusting our preventive measures accordingly. But bottom line is, we have to sustain economic growth, world communication. So this is a major test for all of the politicians around the world. We have students, workers, entrepreneurs with us today. That you are like doctors or immigration officers. You are part of the link in terms of the preventive measures. Whether you agree with it or not, we are all soldiers in this battle. If we can do better individually, we'll be seeing a nearer end. But it's too soon to tell whether this virus will come back in time, in years' time or months' time. But in human history, we have encountered every virus or infectious disease that come our way. And the World Vaccine Day is about to come. And some of the experts, me included, will be carrying a discussion about the vaccination of this virus. So vaccine will be the final salvation for us. I think the Chinese will be part of it, and the Indian will sure be part of it. We are very optimistic nations. So our Chinese nationals in India should be the most optimistic of all the people. And I also hope that you can go back to normal.
我想到您之前说过一句话，说疫情结束后你会安静地走开。
I remembered one of the remarks that you made is that you will quietly go back to your private life after all of this is over, but that day seems to be so far away. A few days ago, the Morning Post of Singapore joined us along with academician Li for a meeting, and he asked the similar question: when will I go quietly from the public sight? I think that's also something that I look forward to, because when that time comes, it means that the world is at peace. I hope that this day will come sooner than later. If I'm always there and if I'm always on the spotlight, it means that this is not over yet. I hope that this thing can be brought under control. Despite all the misunderstandings, all the deterioration in many places, we will recover in the end. We are all connected with similar genes that develop about 100,000 years ago in a small village in Africa. So I'm fairly confident that we will not stop here, and the human society would thrive soon. Okay, our ambassador is back online.
好，哎，没问题，大使非常好，请您刚听到这个问题了吧？回答。
我听到了，是。
Mr. Ambassador, would you like to answer the previous question? So Mr. Wang has raised this question, which is very important. The stigma and discrimination against Chinese nationals. This is a problem that we have attached importance to. As to the stigmatization, we are totally against it. Any mentioning of Chinese virus or Wuhan virus, if such a false nomination is made, we will make our stand very clear publicly to fight against such a slander or a insult to our nation. According to the WHO, it has been very clear that we should avoid naming virus for the place of its origin or place of its first outbreak. That's why we have named it the COVID-19, which is a general name of such a virus in the international community. So whether in India or in any other parts of the world, we should be following this scientific principle and not stigmatize this virus. Second, discrimination. We are very concerned and the possible discrimination in India against the Chinese nationals. The Chinese citizens, the Chinese residents are getting along very well with the local residents because we are both from Asian civilizations, and we all belong to the Asian civilization. So we should communicate on the basis of mutual respect and trust. But we cannot exclude all the possibility, all the possible discrimination. We have to take a right attitude towards them. Several days ago, I saw reports on media written by a famous Indian badminton called Gupta. His father is an Indian and his mother is Chinese. So he looks a bit different than the Indian nationals. In his article, he mentioned that he has suffered from discrimination due to his look. So this kind of phenomenon does exist. But he also mentioned in his article that we have to forsake such a xenophobic attitude towards a certain race or nationals. I also have post comment on my Twitter account to show my support to him. But I believe that most Indian people respect the Chinese nationals and are ready to communicate with one another on the basis of mutual respect. We are all proud to be part of the Chinese nation, and we also respect the Indian nation and civilization. We will treat them with equal respect. However, if unfortunately you encountered with a situation in which you are being discriminated against, my suggestion is first to stay cool-headed and not escalate the conflict so as to protect yourself, but make sure that you take enough evidence on the spot. Second is to report to relevant authorities. If it's really very serious, we suggest that you call the police and call the embassy and consul. If necessary, we will also be talking to the relevant authorities on certain matters and ask them to handle these problems, these conflicts properly so as to safeguard your legitimate rights. Due to time constraints, that's all for today's Q&A session. So, Ambassador, would you like to make some final remarks to our compatriots, Dr. Zhang, as well as our viewers? First of all, my gratitude goes to Dr. Zhang for your informative answering and very humorous comment, I must say. I was very impressed by your remarks. I believe that we have all learned a lot, and we are now more confident in terms of fighting this virus. Some final remarks. First, scientific and reasonable attitude towards the current epidemic in India is key. We have seen some latest development, and I would not repeat them. On the one hand, India is a special nation, very unique nation in the world. The population of 1.3 billion people with very large population density. There are many cities with a population larger than 10 million people. So we are facing with special circumstances when it comes to preventive measures in India. Second, the testing rate in India is quite low. Currently, the testing rate is 300 per million, which is substantially lower than the world average. There are also asymptomatic infected patients. The third condition is that in India, there is still a lack of medical resources or PPE. But despite all of those facts, we must also understand that the Indian government attaches great importance to the preventive measures and control measures. As early as January, they have issued this travel guide to Indian nationals, and on February and March, they have suspended this travel visa for tourists coming from other countries. From March 25th, a national lockdown was implemented. And 1 month later, this lockdown was extended for 15 more days. So these strict measures are taken. The federal government and local government as well as the ruling party and the participating parties have reached a consensus as to the preventive measures.